Good, you're in a good position. Stay that way. Good, good. There it goes. That's the one. Did you hear that one? So today we have Jerry. Jerry is a maintenance man here in New York City. What do you want to look at today, Jerry?
My lower back and my right hip.
Okay. And how long has your lower back been problem?
About 5 years.
Okay, 5 years. And does it hurt like leaning back or more bending forward?
A little both, honestly.
Okay. And what else? You said the hip.
Yeah.
Point to the hip.
Right here.
All right, so it's on the side there.
Yeah.
Here, turn this way so we can see better. So it's right in there.
Yeah.
And is it hurt during certain activities, like sitting in a chair or moving around?
Mostly when I'm trying to go to sleep.
All right, and it hurts in there.
Yeah.
Okay, and how long has this one been bothering you?
About a year now.
All right. Which is worse, the hip or the lower back?
Oh, right now the hip.
Okay,
Yeah.
and turn this way and keep turning. Point to the lower back where that hurts. Can I lift this shirt just a little bit? Okay, so you're pointing just above the belt, slightly to the right. All right, so I'm going to get you to face down. You don't have anything left in your pockets, do you? All right, change is not bad. But I mean like keys or anything like that.
Not at all.
All right, so put your nose here. You'll be on your belly,
Okay.
and your ankles hang off.
Okay.
So you pointed to your right. Point to that hip one more time so I can see it in this position. All right. And then point to the lower back again. All right, so the first thing I want to do is I just want to bend your knees a few times. So when I bring your legs up like this, do you get any more pain in the back or it doesn't affect the back?
Yes, it hurts.
So where does this hurt when I...
Right here.
Same spot. Okay. And now how about if I ask you to lift this leg up in the air? So you're going to lift it like this. Oh, you almost kicked me. All right, lift it again. I'll get it out of the way. Good. And now lift this leg. Good. Keep the leg straight so it's the same way each time. So instead of bending it at the knee, lift the whole leg together like it's one long piece. No, just one at a time. Yeah, so you lift this leg like this. Watch, you relax like this. And then like this. But keep the leg straight. Do you see how you bent it? So do the right first. Do this side first. Perfect. And then do this side. Perfect. So which is harder to lift?
The left.
The left is harder. Okay. When you lift the left, do you feel it on the right or do you feel it somewhere
No,
else?
I feel on the right.
Okay. Did any of those movements hurt the hip thing?
Yes.
Which one?
Yeah, I pulled up the right leg.
But not the left.
Not the left.
So pull up the right leg and dig your thumb into where it hurts. And you're right in there. Okay. Got it. So let go. I'm just learning. I'm just trying to figure out because we never met. So you're new. Some people that are doing this with me, they're long time, patients, clients, whatever. But we just met today. So trying to figure out the riddle of Jerry's hip and back. Like, why is it doing it? And I put these shoes on to check the alignment. So what's kind of interesting is your legs are lined up in this position. Try to figure out what that tells me. I come up to this position where your legs are at a 90-degree angle and the leg does go short. So that typically means we're going to find something on the opposite side, the left side at L4. You've been complaining about the right, but do you feel this? There is a spot there. So let me just adjust it. So it's showing up as a left L4. And I'm just going to put it onto a lumbar setting. I'm going to adjust straight into L4. I know this is nowhere near your symptoms, but it's what showed up on the test. And I keep going because I didn't get it yet. And I finally felt I really made a good contact. So your legs are balanced in position 1. I bring them up to position 2. Now they're even. So I'm happy about that. Let me roll this hip out like this. That made your leg go short. So I'm going to do a correction on the right hip where I'm going to adjust into the hip from the front. So I'm kind of shooting up like this. Boom. And making a pop up. Because your hip rolled in. It rolled in internally and the hip came forward. And that can create an imbalance where you get a chronic tight spot like you have. So now when I check it, it stays even. I'm going to do a little pull on this leg, okay? And that was fine. It didn't really even need it. So put your right wrist on your lower back like this. Leave it up there. And that made your leg goes short again. So we have a little bit of L5. So we found L4 on the left. We're going to drop down. We're going to get L5 on the right. And there, I got it. So put this wrist back up here. We're checking L5. Even on L5. Switch hands now. L4, good. Both hands on the lower back. Just stack them up there. Good. Both hands back down. Now we're going to chase this leg thing, okay? You feel this spot right here? Lift this leg up again. See what you're thinking now. Any less pain?
A little.
All right. Where do you feel it? Lift that right leg again. Point to the spot that you feel it the most. Okay, good. Keep your hand there. Or, yeah. I'm just going to get this tapping chisel, okay? Here, look up so you know what I'm doing.
Okay.
Okay? A little toolbox for you. Put your hand back down. And I'm going to just... And then I'm going to come into the... Oh, I dropped it. Now lift that leg. How's it feeling now?
Better.
Better. Do you still feel it on the side here?
Not as much.
Not as much, okay. So now I'm going to come into that nasty side one. All right. Now I'm going to have you lie on your side away from me with your back to me. So put both hands on that side of the table. Put your ear on this. I'm going to take away these shoes from you because we don't need them anymore. And you're going to put your leg down like this. And you feel that horrible spot right there?
Mm-hmm.
That's the spot, right?
Mm-hmm.
So I'm gonna put my elbow in there.
Okay.
And this should hurt a little bit.
Mm-hmm.
Does it hurt a lot or a little?
A lot.
All right.
Mm-hmm.
Right there, that's it, right?
Mm-hmm. Mm-hmm.
So I'm just digging my elbow, I'm just grinding it into that spot. Now I want you to pull that knee up towards you, okay?
Mm-hmm.
Good, and now drop that leg off the table,
Mm-hmm.
and that makes it worse, right?
Yes.
And pull the leg back on the table, and drop it off one more time, and put it back on the table, and drop it off one more time.
Mm.
And can you see that leg move up and down? Move it back on the table, and drop it off the table. Ooh, right there. Isn't that crazy right
Yes.
there? Good. Okay, so back down. Lie face down again. And test it. Lift this leg up. No, the way we've been doing it with the straight leg. Good. What are you thinking now?
Better.
Good. Now do this side. What do you think now?
Better.
Okay, good. So now lie on your side facing me. So you're going to bend just the top knee. This one stays straight. Move close to me. So you're going to be towards the edge here. Give me this hand so I can pull your shoulder out. So I'm pulling the shoulder out, rolling your shoulders back, bringing your hips towards me. Good. Come to the other side. Take your pillow with you. Sorry if I just bumped your head. Did I bump you? Good. Good. You're in a good position. Stay that way. Good. Good. There it goes. That's the one. Did you hear that one?
Mm-hmm.
So what that was that lower back on the right finally popped. Lie on your back now. Come to this edge. You're going to be closer to this edge, but still on your back. I'm going to reach under and just do a spot in your mid back.
Oh, yeah.
Good. Those should be good, right? Move to the center of the table and come back up towards me. Got it?
Mm-hmm.
Those are good ones, right?
Mm-hmm.
So come stand now and see how you're doing. So you might need a few sessions because those have been hurting for a while.
Oh, yeah. But I still feel better.
But how do you feel?
Much better.
A little looser,
A
right?
little looser, exactly.
How about like bending down a little bit, leaning back?
That's going to be a process. Like
That's-
you said, I'm
yeah.
probably going to have to come back a few more times.
All right.
That's the nature of my job.
But you feel like we got a good start on this?
Yeah, definitely.
All right, cool.
I'll
man.
definitely be back.
All right, thanks.
Thanks a lot, Dr.
I
Bill.
appreciate it.
All right.